All right, so welcome to the second presentation on Krok 2 2020 booklet. 2020 booklet. All right, so let us not waste much time. Let us continue, or let us zoom in and then start right away. So 40% of the workers who polish the art glass using an abrasive disc and have a long record of employment are diagnosed with ulnar neuritis, 21% with vegetative polyneuritis, and 12% with vegetomyofasciitis of the upper limbs. These pathologies are associated with the following harmful factor. Now, if you look at the occupation of these people, these are polish art workers, or they deal with, how do you call it? Heavy equipment. They deal with heavy equipment, and these are vibrating or vibration equipment. They deal with it, and usually people who are overexposed or they deal with these vibration tools, they develop what we call a vibration disease. Vibration disease. And if you look at what we are looking at over here, we are definitely dealing with what? A vibration disease. Vibration disease. The neuritis, the whatever they are talking about here, they are all dealing with what? With vibration disease. Vibration disease. Or sometimes we call it the hand-arm vibration syndrome. Hand-arm vibration syndrome. Hand-arm vibration syndrome. So over here, we are looking at vibration as the harmful factor. So your answer here should be C, vibration. Vibration. After a long drive with the window open, a man developed a facial asymmetry. That means one side of the face. He cannot close his right eye. His right nasolabial fold is smoothed out. Movement of expression are absent on the right. So even if you don't know, think about facial expression. So what nerve controls facial expression? And you will be thinking of what? The facial nerve. Now there's also a disturbance of the gustatory sensation in the tongue on the right. And again, the facial nerve also, one way or the other, has to do with the 2/3 of our tongue. 2/3 of the tongue. 2/3 of the tongue. So if there's a problem with that nerve, definitely that gustatory sensation or the taste sensation will also be disturbed. It will be what? Disturbed as well. So over here, of course, looking at no other neurological pathologies being detected, we will be thinking of what? A neuropathy of the facial nerve. So here, we're looking at A as our answer. A 6-year-old girl complains of body temperature up to 39 degrees Celsius, rhinitis, dry cough, dyspnea. All, of course, you will be thinking of what? A problem with the respiratory, the respiratory system. Respiratory system. All right. Now, she has been presenting with these signs for 5 days already. Examination shows moderate severity. Dyspnea is of mixed genesis. Respiration rate is 28. Pulse is 120. Percussion produces a dull sound in the right lower segment. Now, in the same area, auscultation detects a weakened respiration and fine vesicular wet crackles. Guys, these are signs of consolidation. This is a sign of consolidation. And we said one of the differentials we have to look at for when we are talking about consolidation is, of course, pneumonia. Pneumonia. And that's why over here, we could be looking at what? A right-sided community-acquired pneumonia. Right-sided community-acquired pneumonia. So your answer here should be B. B. A full-term newborn born with body weight of 3,900 grams at gestational age of 39. On the first day of his life, developed respiratory disturbances. There's dyspnea, arrhythmic respiration, cyanosis attacks. On examination, there is paradoxical respiration observed, and left side of the chest lags behind in the act of breathing. On auscultation, the respiration is weakened in the lungs on the left. In the lungs on the left. So again, you could be looking at a possible consolidation, isn't it? Because of the weakened respiration. Maybe something is there. But look at it again. They are saying neurologists diagnose the patient with Duchenne palsy. So over here, they've told you what you could be looking at, or what could be the reason for all these signs and symptoms being present in the patient. Now, complete blood count shows no changes. Now, if it were to be consolidation, you could be thinking of what? Maybe WBC being high because you're thinking of what? Infection. So all of these things could be high. But here's the case, blood count is showing no changes. No changes. So of course, you can rule out any sort of consolidation like pneumonia. You can rule it out easily. So what then is our likely diagnosis? And of course, you know history, when we talk about palsy, it has to do with the what? With perhaps a trauma in the cervical region, isn't it? The upper part of the limbs. The upper part of the limbs. And even though they didn't tell us how the baby came out, if there was a shoulder distortion or there was a birth trauma or something, they didn't tell us that. However, with a diagnosis of palsy in mind, we could be looking at a diaphragm paralysis. Diaphragm paralysis. And you know the diaphragm is responsible for increasing the volume of air in the thorax, and of course, decreasing the volume of air inside the thorax. Let me just say pressure. Yeah, let me just say pressure. So when that is, or that functionality is hindered or is disturbed, of course, we can have all these changes being what? Present. And that's why over here, our best answer will be what? A left-sided diaphragm paralysis. All right. A 30-year-old woman made an appointment with the family doctor for a scheduled vaccination. Again, when we talk about vaccination, it means you are trying to prevent the occurrence of a disease. Disease is not yet there, but you're trying to prevent the occurrence of that disease. And we've talked about secondary, tertiary, we've talked about all of them in our basis. So please do well to watch them. Do well to watch. These are just revision that we are doing. So do well to watch the basis, okay? So over here, what are you looking at for? This is vaccination. So for vaccination, of course, we are dealing with what? The primary health care. Primary health care. Preventing a disease before it even occurs. Secondary, disease is there. Now you are preventing complication. Tertiary, complication is there. Complication has developed, but you are preventing disability. That is just how it is. All right. A 3-year-old girl has been brought to a hospital with complaints of pain in the legs. There's pain in the legs, fever, loss of appetite. Skin is pale, and the mucosa is also pale. Hemorrhagic rash. Lymph nodes are enlarged and painless, dense and elastic, not matted together. Bones, joints, abdomen are all painful. Liver and the spleen are enlarged. Hemogram. HB is 88, color index is 1.3, platelet is 80, leukocyte is 25. Look at the lymphoblast. Now, they are all high. Hemoglobin is actually low, okay? But color index is quite high, platelet is very low, leukocyte is high. But the striking feature here is the lymphoblast. The lymphoblast. And if you can remember correctly, we talked about differences between how do you call it? Definitely, we are looking at a problem with what? A leukemia or a cancer of the blood. Definitely. There's a cancer of the blood. But in a cancer of the blood, first, you have to know whether it is acute or chronic. And secondly, you have to know whether it is of a myeloid origin or a lymphoid origin. And I think we talked about them in our previous presentation. So please, the same applies to this place. Now, if the lymph normally don't have blasts more than 5%. So if you have blasts in a cell for more than 5% or of more than 5%, you are definitely looking at what? A cancer of the blood. And this cancer is of the, how do you call it? The lymphoid origin. So actually, the actual diagnosis of this will be what? Acute lymphoblastic leukemia. Acute lymphoblastic leukemia. Lymphoblastic. All right. But over here, our best answer, obviously, would be what? Acute leukemia. Acute leukemia. All right. And don't forget too that we have what we call the SMART cells and then the Comprinch cells. That also is a clue that we are having what? A leukemia. And I think there's a question like that. So just note that. All right. After semolina was introduced into a diet, you know, semolina is a process or a purified wheat. 1 year ago, after the introduction of this semolina, a 1-year-old child for 2 months has been presenting with loss of appetite, irritability, loss of body mass, loss of previous learned skills. The feces are copious and foul smelling. The skin is pale and dry. Hair is brittle. Abdomen is distended, while the limbs are thin. Stool are showing what? Fatty acid. What is the likely diagnosis? Yes, I may mention of what? A processed wheat. You know, there are some babies or there are some people who are allergic to a protein called gluten. A protein called what? Gluten, or proteins that contains what? Gluten, or food that contains what? Gluten. So when a baby or when food is introduced and these people are allergic to this kind of thing, the disease is called what? A celiac disease. Celiac disease. So celiac disease is simply an autoimmune disease that occurs due to injection of gluten, gluten. And they can be found in the wheat, in oats, yes, in oats, semolina, that's a purified wheat. You can also find them in some cereals like corn, like millet, like sorghum, like even rice and things like that. You can find some of these things in them. So if you want to prevent this, that means you have to remove any food that contains these things. And sometimes when you buy food from the shop, I mean, they tell you the ingredient, baby's food, they tell you the ingredient, what it contains. So you always read them if your child is allergic. I mean, is so that's allergic. Yeah, basically the same thing. All right, so over here we're looking at what? At a celiac disease. Celiac disease. A 73-year-old woman came to the family physician for one of her regular follow-up examination. 3 months ago, she was found to have type 2. So this is what type 2 diabetes mellitus. So in the comment section, give me the differences between type 1 and type 2. What is type 1? What is type 2 diabetes? Just give me those differences. Let me know if you understand all of these things. We've discussed about them already. We've discussed them. So please. All right. Now, she was keeping to her diet and exercise plan and taking Phyto preparations. On examination, her fasting glucose was within the range of 7.8 to 8.6. Glycated hemoglobin, that's HbA1c, glycated hemoglobin is 7.9. Usually it's supposed to be more than 6%. Height is 160, weight is 83. The question is, what is the first drug that you can prescribe for somebody suffering from type 2 diabetes? And of course, you are looking at what? Metformin. So your answer here is A, metformin. That's why I told you to go and look for the difference between type 1 and type 2. When do we use insulin? When do we use metformin? Metformin is not used for type 1. It's used for type 2. So take note of that. All right. A patient has gradually lost consciousness, so loss of consciousness. So CNS manifestation is there. The skin is pale and dry. There is a smell of ammonia from the mouth. Of course, you know what is definitely causing this loss of consciousness. Ammonia. And usually ammonia is detoxified by the liver. So if the liver is having a problem, definitely ammonia will be more in the blood, and this could affect the brain because the brain doesn't like ammonia at all. All right. Respirations are deep and noisy. Heart sounds are muffled. Pericardial friction rub is present. Blood pressure 180, 130. Hemoglobin, blah, 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 blah. But these are the most striking features. Urea, 50. Creatinine, 1,200. Osmolarity, 350. No excretion. No excretion. So what is the diagnosis? Now, normal urea is supposed to be about 3.3 to about 8, if I'm correct. To about, I think to be corrected anyway. It's about 3.3 to about 8.3 millimole per liters. So having a urea of 50, that tells you that indeed this ammonia is causing more harm than good. And so therefore, what condition are we having over here? We are having a condition called what? Uremic coma, urea coma. That means coma as a result of high concentration of urea. Uremic coma. And of course, this can lead to kidney failure. But the problem why we are having the kidney failure is because the condition here is a uremic coma because the person has lost consciousness, isn't it? But the complication of it is what? Acute renal failure, or it can lead to acute renal failure. But the question wants us to know why there is a loss of, the reason for the loss of consciousness, and for which matter there is what? Ammonia smell in the mouth. And that is why over here we will be going in for the uremic coma rather than the renal failure. All right. So over here, your answer would be what? Would be D, uremic coma. All right. A 10-year-old boy came to the polyclinic with complaints of a stuffy nose. It is known that these signs occur in the child periodically, guys, in the spring and in autumn. Of course, you know what you're thinking about. Exactly, and you are correct. So this is what? Allergic reaction or allergic rhinitis. And look at it. History of atopic dermatitis, bronchial asthma in the family, with the father. Boy's face is pale and slightly swollen, respiration rate. Guys, look, the swollen and the pale nasal mucosa. Please, you are suspecting what? Allergic rhinitis. So please don't confuse yourself. So your answer here is what? Is C. Don't forget they occur seasonally. It's not every time. It's season by season. All right. Disease onset was acute. A child developed general weakness, pain in the joint, fever. Later, these signs became accompanied by itching. Itching skin rash manifested as erythematous spots, 2 to 5 centimeters in size. Rash tend to hemorrhagic. Large joints are painful and swollen. Pain attacks periodically occur in the paraumbilical area. There are signs of intestinal hemorrhage. What is the most likely diagnosis? So whatever it is affecting small blood vessels or disorder that causes small blood vessels in your skin, in your joints, in your intestine, in your kidneys to become inflamed and bleed. That is what is here. And the term for that is called what? Hemorrhagic vasculitis or Hinoch-Purpura. Hemorrhagic vasculitis or Hinoch-Purpura. In some books, you can find what? IgA vasculitis. That is immunoglobulin A vasculitis. And sometimes their rash even can come with a specific color, like a purple color. a purple color. So in some books, some questions, they will bring the color of the rash for us. They will bring the color of the rash for. Although over here they say it's what erythematous. That means it's more or less like reddish in color, not purple. But then typically they are purple in color, and they and the places that they affect the most include the lower legs, the buttocks. These places they can affect, and of course the joints, the skin. All these places can all be affected. So over here we're looking at hemorrhagic vasculitis or Hinoch purpura. So your answer is D. A 34-year-old multipara was brought to the labor ward with a regular labor activity. Her pelvic size is this. Vaginal examination shows 6 centimeters cervical dilatation. Amniotic sac is unbroken. The fetus is in the bridge presentation with the buttocks pressed to the entrance into the lesser pelvis. The promontory cannot be reached. No exostosis. Fetal heart rate is 140 per minute. Expected weight is 2,800 grams. Guys, even though the baby is in the breech presentation, we can still deliver this baby vaginally. In fact, we should deliver the baby vaginally. And looking at the fact that the fetal heart rate is 140, it means the vital signs of the baby is good. And the weight is not big enough to cause a problem. It's just 2,800. And we said the normal size is about 2.5 to 3.5. So 2,800 grams mean that the baby size is good. So you can come out of it, out of the woman vaginally. And that is the natural birth canal, So over here, our answer will be what? Will be B. A 54-year-old woman complains of a forged vision in her right eye, rainbow circles in her vision, headaches, and nausea. Within the last month, she twice experienced a similar condition, but back then all the signs eventually disappeared and her sight was restored. But currently, all the signs have been persisting for over 2 days. The eyelid is edematous, congestive. I don't even know what they mean by ejection of the eyeball. Corneal opacity, shallow anterior chamber of the eye, dilated pupil that is unresponsive to light. Guys, all of these grammar they are telling us, forget about them. This is where your diagnosis will lie on. Intraocular pressure is 48 millimeters mercury. The normal intraocular pressure should be between 12 to 22. So having 48, that is too high. And the term for increased intraocular pressure is called glaucoma. So here, our answer will be A. A 3-month-old child with signs of rickets. Guys, I will not even continue. You know what it is. Rickets has to do with what? Vitamin D deficiency. And talking about vitamin D, we're talking about calcium metabolisms, or we're talking about calcium in the blood. So if there's no calcium, that means the baby cannot utilize this calcium for bone formation or for mineralization. Yes, so that's what we're looking at over here. So over here, what is the cause of the signs of the disease? And of course, you are looking at what? You are looking at decreased calcium levels. So your answer is E. But if they ask you which vitamin, of course, vitamin what? D. Vitamin D. Calcitriol. All right. After eating shrimps, a 25-year-old man suddenly developed a skin itching. Some areas of his skin became hyperemic or erupted into vesicles. Make your diagnosis. Guys, this thing took place after eating the shrimps. So the person is reacting. It's reacting. So this is what allergic reaction. But of course, the right term here will be what? Acute urticaria. Or some of you call it, is it hive or hive? You know how you want to pronounce it. It's you, so please. That is just it. So over here, you are looking at what? Acute urticaria. Acute urticaria. They are all forms of allergic reaction. So this is because of eating the shrimps. So your answer here is C. A 35-year-old woman came to the family doctor with complaints of profuse menstruations that last up to 10 days. Examination shows that the uterine cervix is without changes. The uterus is in anteflexio, has normal size, is mobile and painless. The uterine appendages on both sides are without peculiarities. The family doctor made the provisional diagnosis of abdominal uterine bleeding. So if you have an abdominal uterine bleeding, you need to do an examination, perhaps to help you know the cause of the abdominal uterine bleeding. And of course, the instruments of choice will be what? Transvaginal ultrasound. Transvaginal ultrasound, not abdominal, because this is not a problem with the abdomen. This is a problem with the vaginal area or the womb, let me put it that way. All right, so over here, we're looking at what's transvaginal. So your answer here should be B, transvaginal. All right. To help you to know if there's cyst, there's fibroid, there's tumor, any other growth, to help you to detect it. All right. A 19-year-old boy was diving and hit his head on the bottom of the pool. Chai. He complains of pain in the neck. Head movement are limited and painful. During examination, his head is bowed forward and to the right, and the patient supports it with his hand, picking the tense neck muscles and protruding spinous process of the fourth cervical vertebra. So there's a problem with the cervical vertebra. When pressure is applied to this process and to the head, the pain intensifies. Guys, we could be looking at the possible fracture of the neck. Fracture of the neck. And usually when people have accident, one of the things that we have to check is the neck. It's like those people who play football. When they jump and they fall down, you wear that the team doctors, whatever, they have to go and hold the head area. So they hold the head area to make sure everything is fine, and of course, to make sure that the person is breathing very well and things like that. The reason is because one thing about the neck is that, or the spine, is that when there's a problem with the spine, it can affect your respiration. Or CNS manifestations could ensue due to a problem in the neck or in the spinal cord. So it's always a delicate place. So we need to support the neck to make sure that it's stable so that the person will not be moving it anyhow to cause problem for us. So, however, over here, definitely there's a fracture in the neck, or there's a neck fracture. No doubt about that. It is a bone, not a muscle. So don't go and say this is a neck muscle injury. No. And there's no spinal root injury either. Not yet. Not that we can see. If it will be spinal root injury, it means that some vessels are damaged. And that's what I'm saying. It can lead to respiration problems and CNS manifestation problems. But in this question, we're not seeing such thing. Although there's pain and stuff, and when you touch it, it becomes more painful. So over here, we will be looking at what? An uncomplicated, because there's no problem. Even though the person is having cervical fracture, but there's no a lot of issues to be looked at, or there's no complication development. So over here, we will be looking at what? At an uncomplicated cervical fracture. Uncomplicated cervical fracture. A patient is 45 years old. He was referred for a consultation with a psychiatrist due to complaints of abdominal pain and discomfort that occurred emotionally straining situations. So there are signs and symptoms of what? Abdominal pains, discomfort, due to what? Emotional situations. Now, objectively, no changes of the gastrointestinal tract were detected. Guys, there's no changes whatsoever. No changes. Everything is good. But this person is having what? Complaints. So what do you think it is? Definitely you are thinking of something that has to do with their emotion. So there's no particular organ damage, isn't it? But due to the emotion of the patient is having all these symptoms. And we call this somatoform autonomic dysfunction. Somatoform autonomic dysfunction. So that is what we need to be looking at over here. Even though they said the patient is having 10 years of alcohol poisoning, but this is not a case of alcohol poisoning. No, this is not a case. The patient has been repeatedly visiting, you see, but still, who were unable to find any significant changes. Now, with chronic alcoholism, trust me, you will see some organic changes. There will be organic changes. There will be some tissue damages and stuff. The liver, the brain, all of these will be affected, or they could have problems. But here the case, nothing is found. Nothing is found. So over here, well, and look at it. They're saying that the prescribed therapy was ineffective. So whatever they gave, it was ineffective. So over here, we just need to calm the person down, because this person is suffering from what we call what? Somatoform autonomic dysfunction. Somatoform autonomic dysfunction. A 21-year-old man was hospitalized on the second day of the disease. His general condition is severe, body temperature is 39. On his skin, there are numerous irregular-shaped hemorrhagic elements. Diagnosis was made. Meningosemia was made. The next day, his body temperature suddenly decreased. Pressure 80-40. Pulse is 120. Acrocyanosis. What complication did the patient develop? What complication did the patient develop? And over here, we will be looking at WFS. When we say WFS, we are referring to a Waterhouse Friderichsen syndrome. Waterhouse Friderichsen syndrome, which is just an adrenal gland failure. Adrenal gland failure. And of course, it is commonly associated with a severe bacterial infection. And of course, but mostly it's as a result of Neisseria. And of course, you know, meningosemia is one way or the other a type of Neisseria. All right. So over here, we are looking at acute adrenal insufficiency to be our answer. So your answer here is A. All right. A forensic autopsy of the body of a 59-year-old man who died suddenly at home without signs of violent death. There are no signs of violent death. Shows pink skin and mucosa. Pink skin and mucosa. Okay. Light bright red blood and bright red plethoric internal organs. Forensic toxicology testing detected 1.4 blah 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 of ethanol in the blood and carboxyhemoglobin levels. Guys, carboxyhemoglobin levels. Hemoglobin, what do they normally bind to? They normally bind to oxygen. So for us to have over or 55% of the hemoglobin binding to carbon should tell you that we are having carbon monoxide poisoning. Don't let the ethanol confuse you with alcohol poisoning. No. Sorry. with alcohol poisoning. This is a case of what? Carbon monoxide poisoning. Carbon monoxide poisoning. So your answer here is D. Please don't forget that we have medentweb.com that you can go there and practice your Krok. After watching videos like this, you need to practice to make sure that, yes, you can understand. I mean, you have understood it. Yes, you are getting it. If it should come to Krok, you will get it right. Go there and practice. And it comes with explanation as well. So for every question of what I'm saying, I've just summarized them into writing for you. So go there and enjoy it. Our team has done a tremendous work on these things. So please utilize the website, okay? Utilize the website as well. All right. medentweb.com. medentweb.com. All right. Good. So we have a 45-year-old man with a history of myocardial infarction, developed a brief attack of palpitation. Attack, brief one, accompanied by the sensation of lack of air, fear, and vertigo. Blood pressure is 90/60. ECG shows extended KRS complex. So this is where our problem is. Attack shows extended QRS. And you know QRS complex deals with ventricular, how do you call it? Ventricular contraction. Ventricular contraction. So having this thing over here means that the problem will be with the ventricles rather than what? Than the atrium or the atrial problem, guys. Now, with a heart rate of 160 per minute, this is a tachycardia. 160 per minute is too high. So this is a tachycardia. So we'll be able to establish that we're having what? Ventricular problem. And of course, tachycardia is there. So even without knowing, this is definitely what? A ventricular tachycardia. Ventricular tachycardia. But these are attacks. So they occur suddenly. They are attacks. It's not planned. It just happened. So we're talking about what? A paroxysmal ventricular tachycardia. Paroxysmal ventricular tachycardia. All right. But let's continue. There's a discordant shift of ST segment and in the T wave dissociation of the atrium and the ventricular rhythm. The atrium and the ventricular rhythm. What disturbance, guys? So we're looking at what? Paroxysmal ventricular tachycardia. Tachycardia. The atrium contraction is not moving with the ventricular rhythm. That is what a dissociation. All right. For 20 years, the role of excessive weight in ischemic heart disease development among the working age male over 40 years was studied. Okay. It was determined that overweight men develop ischemic heart disease more often. What type of epidemiological study is it? And over here, we will be dealing with what we call a cohort study. Cohort study. A cohort study is simply a type of medical research that is used to investigate the causes of disease and to establish links between risk factors and the health outcome. Risk factor and the health outcome. So the question now is that which of the following is a risk factor? Of course, the weight is a risk factor. Obesity is a risk factor. Weight is a risk factor. Smoking is a risk factor. I'm just mentioning. But over here, we are dealing with what? With overweight, obesity. So, yeah, so over here, we are going to compare why or the link between obesity and, of course, ischemia. Ischemia. And of course, what is ischemia? Ischemia means inadequate supply of what? Blood to the tissues of the heart. What can cause it? Of course, atherosclerosis. And people who are obese or people who are overweight, they have high level of cholesterol or LDH. This LDH will increase cholesterol concentration at the, in tissues, and that can lead to injury of that place, leading to what we call atherosclerosis. I don't want to go through that process of explanation, but basically that's what it is. Well, so over here we are looking at what? At a cohort study. A 20-year-old woman complains of headaches, vertigo, tearfulness, vomiting, pain in the area of the heart, and tachycardia. The signs appear, guys, look at it, 6 to 7 days before menstruation and disappear in the first days of menstruation. Make it like a diagnosis. Of course, you are looking at this as a premenstrual syndrome. No need to waste time. Premenstrual syndrome. A woman came to the gynecologist to plan her pregnancy. She was advised to increase her intake of the product rich in folic acid, particularly by soya beans, bread made of coarsely ground flour, fruit, leafy green vegetables. Such changes in her diet will work toward the prevention of what? So why do we give folic acid, or why do we recommend folic acid for patients? Pregnant women to be specific. We do this because it helps in neural tube closing. So over here, we are trying to prevent the non-closure of neural tube in fetus. The non-closure of neural tubes. Because closing the neural tubes, which are more or less like the nervous system, because they will eventually grow into the nervous system. And if that is not done properly, this baby could have some anomalies, which you don't want your child to have. So over here, we are looking at what? At non-closure of neural tubes in the fetus. Prevention of this. All right. A 48-year-old woman, 48, look at it, 48, complains of disturbed menstrual cycle. So anytime you see old women complaining of menstrual cycle problems, one thing that comes to your mind, either they are about to enter into menopause or they're already in menopause. Exactly. All right. Now, her period lasts for 7 to 9 days and are excessively profuse throughout the last half year. She notes occasionally hot flashes, insomnia, irritability, headaches, skin is of normal color, blood pressure is 150/90, pulse 90, rhythmic, abdomen is soft and painless. Ladies and gentlemen, what is the likely diagnosis? I've told you this person could either be having about to enter into menopause, or it's already what? In menopause. So over here, you are looking at what? A menopausal syndrome. Menopausal syndrome. And your answer here is of what? Menopause also means climacteric. All right, so that is the same thing. Menopausal syndrome or climacteric syndrome. So your answer is C. A pregnant woman at 34 weeks of gestation underwent Dopplerometry of umbilical circulation, which revealed a reverse diastolic component. Guys, reverse diastolic component. Now, usually the flow in the umbilical artery must always be in the forward direction. That is the normal flow. It must be in the forward direction. So if you have something that is the opposite, or that's in the reverse case, ladies and gentlemen, it is cause for alarm. We have to look at it critically. But look at it again. Objectively, the height of the fundus is 27. About the pubic bone. Fetus is mobile, located above the entrance to the lesser pelvis. Fetal heart beats. Vaginal examination shows that the uterine cervix is closed. Its length is 3 centimeters. What tactics should the obstetrician choose? So even though the cervix is closed, the heartbeat of the fetus is even normal, but we don't want to risk anything. anything. We don't want to risk anything. So now, a child having a reversed diastolic component or a reversed blood flow, if it becomes severe, this can lead to intrauterine growth restriction. It can lead to intrauterine growth restriction. Intrauterine growth restriction. And we don't want to get to that stage. We don't want to get to that stage. So for management, a fetal biophysical profile is done. I repeat, by management, first of all, you have to do what? A fetal biophysical profile, which is actually a prenatal test that is used to check a baby's well-being. So first of all, you must check the baby's well-being. And if you look at the question over here, of course, fetal heartbeat is what? Is good. So we could say that maybe the fetal well-being is actually what? Maybe it's good, isn't it? It's good. It's good. It's good. So you check for the breathing rate, the movement, the muscle tone, whatsoever you need to check out for. That we have to look at it, isn't it? So the test you should choose, we should have done the fit. I mean, for me, the first thing to do is the biophysical profile test. That should be done to check the welfare of the body. So I assume that has been done already. I'll just assume that has been done already. So if we sense that this child is in distress, which of course he or she is not, well, Krok says it is still cesarean session. I don't know why we don't need to do urgent cesarean session, but then maybe something is wrong. Just maybe something is wrong. But for me, I think we should have done the fetal biophysical profile. And if it is good, well, we just wait. We just wait till maybe pregnancy time. Delivery time. Then we deliver the baby. But now we have to do an urgent cesarean session. Urgent cesarean session. So according to Krok, that is our answer. But though I stand to be corrected, so please feel free to let me know why you think it is urgent cesarean session. But I think it should have been a fetal biophysical profile. Should have been done first. All right. So it's up to you. Let me know what you think. But in Krok, answer is urgent cesarean session. So please feel free to share your opinion. All right. A 26-year-old woman was hospitalized into gynecological department with complaints of body temperature up to 38. There is fever, general weakness, and dead red blood discharge from her genital tracts. She is hemodynamically stable. 2 days. 2 days ago, she underwent a medical abortion, guys. So this is where your whole thing should be on. 2 days ago, what happened? There was an abortion. And the pregnancy was about 8 weeks. That's 2 months. Ultrasound is detecting some remains. What should you do? Of course, extract everything. Extract everything. Many of you have gone for the DNC, isn't it? Yes, and you're not far from right. But in the option here, there's no DNC, so what do? Of course, you can also use a vacuum extractor or vacuum aspirator to remove everything from the womb. So over here, that's why over here, our answer will be what? Will be the revision of the uterine cavity with the vacuum aspirator. And of course, we need to give antibiotic therapy as well. This will help with the infection. All right. Good. So we have a 23-year-old woman with type 1 diabetes during the second week of a community-acquired pneumonia, developed nausea and vomiting. In the evening, she lost her consciousness and was hospitalized. So there's loss of consciousness, CNS manifestation. So whatever it is, look out for what? Complications of this diabetes mellitus. As simple as that. look for what? A complication of this diabetes mellitus, or maybe the community-acquired pneumonia. Look for complications. So let's continue. The patient's skin is pale and dry, her respiration is loud, tongue is dry, brown deposit, heart is 129 per minute, blood pressure is 85/50 per patient, abdomen provokes no response, liver is +3, guys. So this is your complication. Acetone test is positive. Acetone test is positive. With a glucose of 26, that is a lot. So definitely you are looking at what? At a DKA, diabetic ketoacidosis. So here our answer will be what? Will be D, ketoacidotic coma. On the 5th day after giving birth, a postparturient woman complains of a pain in the left mammary gland and body temperature of 38. So after giving birth, 5 days, now you're having these pains. Examination shows that her mammary gland is enlarged and painful on palpation. Nipple is edematous and has fissures. That means like cracks. The upper external quadrant of the gland is hyperemic. Name the measures that would have prevented the development of this complication in the patient. What measure would have prevented? So over here, we could be having how do you call it? A case of lactational mastitis, isn't it? Yes. We could be having a case of lactational mastitis. Lactational mastitis. So if it is lactational mastitis, guys, we'll talk about these things. I beg, just of course, we will give antibiotics regardless. We will give antibiotics. But most importantly, how to prevent it. They said, what measure would have prevented the development of this complication in the patient? Guys, this is when the men comes to play. Men. I know you're happy. Men. So over here, we need to be pressing the breast very well. So there should be feeding on demand. Feeding on demand expression of the breast milk. Feeding on demand and expression of the breast milk. And of course, prevention of the nipple fissure. So if we express it, the breast milk like that, it will help, or it would have helped to prevent this from developing. And don't forget, we must give antibiotics as well. You need to give antibiotics. Sometimes it's good. All right. So over here, we're looking at what? We're looking at C as our answer. C as our answer. All right. Okay. On ultrasound of the thyroid gland, a 47-year-old woman presents with hypoechoic node, 1.6 centimeters in diameter, with a bled margin and intranodular hypervascularization. Doctor suspects thyroid carcinoma, guys. They've already told you the diagnosis. What they are suspecting, or the provisional diagnosis. Thyroid carcinoma. So for every cancer, we've said it countless number of times, you always need to do what? A biopsy to verify if indeed it is cancer or not. And that's why over here, your answer should be what? A fine needle aspiration biopsy. Fine needle aspiration biopsy.